Hi, Dr. Pelto here. I had a patient ask the other day, well, what is the whole process after getting an orthotic or I get scanned? So in our office, we scan orthotics. There are different ways of getting orthotics. So some people use a scanning device to scan a 3D scan. Other people use like these boxes where they put your foot in the box, and others use plaster. Occasionally, we still use plaster, especially for really flat feet, because it molds better to your body. But I want to explain the process afterwards so you know kind of what is the whole process. Well, first of all, you scan the foot and we put in a prescription afterwards. So we put in a prescription and usually it's in an iPad, and we send all that electronically to a lab. It's a pedorthist or an orthotist, and they are going to make an orthotic. They're going to make an orthotic for us. And that fabrication can take anywhere from a couple of days to a couple of weeks. If you want to rush the orthotics, meaning you want to get them quicker, you can do a rush and they'll make it in a couple of days. It's pretty amazing how quickly they can do it. But they usually have a process, meaning they have a what happens when you get a rush is they just put you in the head of the line, right? They put you in the head of the line because it's kind of like going to Disney, right? If you want to go on more rides or get it quicker, you can go to the head of the line. So they fabricate the orthotic. Once it's done, they send us the orthotic back. So let me show you an example. This is an example of like an orthotic, and I just did this other video on orthotics. It's going to look like something like this orthotic device. You're going to get that from our office, and we're going to give you a piece of paper with break-in instructions for the orthotics. Okay, it's going to explain how to wear it. Basically, you want to put it into a shoe with a sock liner that pulls out. So the sock liner where your foot is, that's going to come out. You're going to put the orthotic in there and you're going to break them in, meaning an hour the first day, 2 hours the next day, and keep increasing an hour. And you might find some knee, some hip, some back issues initially, and it's going to take a while to get used to them. We do a follow-up in our office at 6 weeks, unless you have any real issues. If you have issues, you come back in sooner. So you're going to try them out for 6 weeks. And then we're going to make a follow-up and adjust as needed. So sometimes we have to adjust. The most common adjustments for us are either increasing or lowering the arch in the orthotic. And then many times our patients get an additional pair, and that's going to improve compliance because most patients or most people have two types of shoes that they wear. For example, I have like an athletic shoe, and then I have like a dress shoe. So to increase compliance, we tend to get 2 pairs of orthotics and then move it from shoe to shoe. And that's the whole process after the scan. And then we tend to see our patients once a year to evaluate how those orthotics are doing, if they're comfortable or if there are any issues with them, if the materials have changed or people's feet have changed and things like that. Orthotics tend to last between 3 to 5 years. It really depends if your foot type changes or the orthotic breaks down, then we could do another pair. Okay. If you have any other questions about orthotics, let me know. I know I get this question a lot. Can I just do over the counter? And I say, yes, you can. You can try over the counter first. But if everyone got better with over the counter, we wouldn't have a job. So if you've tried 2 or 3 over the counter and you're not feeling better and you've tried different shoes, you might need an orthotic or you might need a visit with a doctor. Okay. Okay. Thanks, guys.